Recording. And if more colleagues join us, that's great. Hello and welcome everyone. Thank you for joining us today for the Hate Crime Research Group seminar. For those of you who don't know me, my name is Irene Zempi. I am the lead for the NTU Hate Crime Research Group and also the chair of the BSc Hate Crime Network. Today's seminar will focus on the experiences of deaf prisoners inside prison and after release. This topic is massively under researched and more generally in relation to disabilities in the criminal justice system. I'm really pleased to welcome Daniel Mcculloch from Open University. He will talk about this project. Unfortunately, Laura could not make it today, but I'm sure Daniel can talk in detail about this project. The presentation will last about 30 minutes, and then we will have maybe around 20 minutes for questions, thoughts, reflections. And the presentation is recorded as well. I will now hand over to Daniel. Thank you.
Great, thanks very much, Irene, and thank you for the invite to talk. So as you said, I'm Dan Mcculloch from the Open University. Unfortunately, my colleague Laura Kelly-Corless from the University of Central Lancashire can't join today, but this is really presenting work that we've done, either of us in research and some that we're doing together at the moment. So just a little bit about who we are. We're scholars that have worked in this area for a number of years. I did my master's research in this area 14 years ago now. It's a bit scary. And Laura did her PhD looking at the experiences of deaf prisoners. We both published in this area, and Laura's also produced a set of resources to support prisons in meeting the needs of deaf prisoners called Think Deaf resources, and these have been circulated to prisons throughout England and Wales. So why is this topic important, and why is it important now? Well, deaf prisoners experience what we would argue is a disproportionate amount of pain, deprivation, suffering beyond what might be expected for prisoners, most prisoners during their time in custody. And it seems to be more severe than for hearing prisoners, specifically because of their deafness. Also, because we've got an aging prison population, this cohort is growing. So that this cohort is growing all the time. And this also means that it's a growing issue, if you like, within prisons. And although in theory, adjustments ought to be implemented in line with the Equality Act 2010, research that we've both looked at or both done in this area shows that there is this continual ambiguity over the interpretation of the term or the idea of reasonableness in the term reasonable adjustment, which is the key term really that looks at what changes would be required to meet the needs of people in this area. More recently, the BSL Act, the British Sign Language Act 2022, might be understood to be a landmark piece of legislation in this area. It, for the first time, recognises BSL as a language of England, Scotland and Wales, and it requires public services to feed back on the progress that they're making in terms of meeting the needs of BSL users. So arguably what we're seeing for the first time is significant attention being given to the rights of deaf people, both politically and publicly, but we're really yet to see whether that it plays out in a meaningful way, I suppose. So one of the things I suppose you might want to know is the scale of this issue. How many deaf people are there in prison? Really, it's difficult to say. Although there are estimates, there aren't any reliable data in this area, and there are a few reasons for this. The first is that the recording mechanisms that are available aren't very accurate at getting this issue. The questions that are asked during a healthcare screening aren't really adequate, and even where those questions are there, they tend to be used inconsistently because people don't really understand the details of what's being spoken about. And here, something that's important to know is that there are different ways of understanding deafness, or different aspects of deafness. So you can see I've got it there with a small d and then with a big D. The small d might be can be understood as talking about what might be called audiological deafness. So this is where people are predominantly part of a hearing culture. They tend to communicate in spoken and written English. Very often will wear hearing aids, and as part of this overall this dominant hearing culture, quite often deafness is understood in these terms as some kind of deficit, as a disability. So deafness is framed in a particular way in that dominant hearing culture, whereas a big D, deafness, tends to relate more commonly to what might be thought of as cultural and linguistic deafness. So this is people that would consider themselves culturally and linguistically deaf might, for example, think that deafness is a distinct subculture with its own norms, values, its own language. BSL is a language in and of itself. So it sits as a distinct culture from hearing culture, and it's something to be proud of rather than something that is seen as stigmatizing or something to be ashamed of in any way at all. But what we see in terms of the data is that these categories aren't really differentiated. There isn't a distinction really within the data, so it makes it difficult to understand the details of what's going on for people. So talking a little bit about audiological deafness in prison, as you'll all know, prisons traditionally have been set up to house working class hearing males. Deafness is therefore quite often seen as a deficit in such environments. These environments are overwhelmingly dependent upon sound and verbal communication, and without hearing, everything therefore about these environments is somewhat harder. And that means that appropriate resources to support people in hearing are vital. Things like mini comms, vibrating alarm clocks, over-ear headphones, hearing aids, these kinds of things become really important for deaf people in prison. But what we see is that prisoners are often reliant on the awareness of other people, of funding being there, and of support from others to make things happen. And Laura's written about 4 factors that really make a difference in thinking about this. So awareness, being aware of deaf people's needs, the resources that are available and where they are allocated, whether those resources are allocated to supporting deaf people or other people that might have other sorts of what might be termed additional needs within prisons. The inclination of staff to actually support deaf people in prison, and accountability when things don't happen. Traditionally, little has been done where people's needs haven't been met, and so without accountability, very little changes. And that means that the kinds of resources that make a difference are often not available or allowed within prisons, even if they are available. And where they are available, quite often they're not well maintained because it's not fully understood why these are so important to deaf people. It's not seen as a priority within prisons. So these 2 quotes hopefully explain some of this. So or get some of this. So the first one, they're a bit parsimonious with the batteries. They give you one little card and that's it. And then when you queue up, there probably won't be any at the health kiosk. So it's one of intermittent supply, which causes great problems for us, because if you lose your hearing, you just can't function at all. Just trying to function as a prisoner, doing the everyday things that are part of the system, can be very difficult if you can't hear properly. And the second one, communication is really important in man-made volatile environments. And without a hearing aid, I found it hard to communicate, so I found it difficult. If I didn't have them, it would be impossible. This environment, more than any other, is all about communication. And without my hearing aids, I literally don't think I'd be able to survive. So you can see how important it is to people in those kinds of environments, the kind of impacts that not having those aids would have. So I suppose we would frame some of these things as being pains for deaf prisoners. And we would say that without access to hearing aids and other sorts of equipment, deaf prisoners become isolated and excluded from prison life. There could be things like issues hearing tannoys, being unable to hear the television, feeling unsafe because you cannot hear things like fire alarms ringing, but also because you cannot hear what's going on around you. People walking behind you or calling you, things like this. So it can be a very isolating environment. And then as well, within things like appointments, there can be difficulty in communicating with doctors, with solicitors, taking part in training and education. So exclusion from those more formal aspects of the regime as well. And then it can be harder to communicate with people outside of prison, family members on the phone, things like this, because again, the needs aren't being met. And the real difficulty in building relationships with other prisoners, things like having subtitles on a TV or having a TV louder so that you can hear it. Interaction during recreation time. If you can't hear what people are saying, then it's very difficult to build friendships, to develop trust. And again, this quote hopefully gets to some of this, is where it says, "I feel left out of much of the prison humour because I cannot hear the small talk, kind of jokes and comments that cause laughter and smiles." That sense of exclusion just from the day-to-day, the seemingly mundane, but actually the very important things that help you to cope with prison life. So moving on then to talk a little bit about cultural and linguistic deafness in prison. As we've spoken about, verbal communication is key in prisons. And deaf prisoners quite often need access to BSL interpreters or other kinds of communication support in order to partake in meaningfully in prison life. For example, things like accessing education, as we spoke about earlier, undertaking assessments, engaging in training, but also in thinking about appointments. What sometimes happens is that an interpreter, for example, might be booked for an appointment, but might be booked for the wrong time, or doesn't necessarily have the right skills for the needs of the person going to that appointment. So this misunderstanding about what's required. And then we also see that things like prison policies, the expectations when someone arrives in prison, sentence plans, they're often not very clearly explained to deaf people. Quite often, these sorts of documents or ways of doing things aren't made very BSL friendly within prison. So they're really difficult people to make sense of and get a hold of. And then on top of that, there's very often a lack of access to other deaf people, other culturally and linguistically deaf people within prisons. So there's this sense of not being able to talk in your own language, your chosen first language, being able to have someone that understands your culture, your ways of doing things. So this sense of isolation is really, really there for culturally and linguistically deaf people in prison. So to pick up on some of these bits and just kind of reiterate them in some ways, deaf prisoners, culturally and linguistically deaf prisoners, become almost completely isolated from the regime. Laura, in one of her publications, has claimed that this effectively is a form of enforced solitary confinement for these prisoners at times. And they're largely unable to partake in education, training, or rehabilitative programs, as well as being excluded from those more formal aspects of the regime, like appointments. I suppose one of the impacts that we would say about this is that it can be almost impossible for people to fulfill the requirements of things like sentence plans. And that can be really problematic for demonstrating when it comes to parole that you have taken steps to what I guess would be termed meaningfully reduce your risk. And that is particularly tricky for when we were talking to prisoners, some of those that were serving indeterminate sentences. It effectively had the effect of elongating their sentence compared to someone that could access those aspects of the prison regime. So it had really quite severe impacts for people. And I think also one of the other things is that these prisoners are at greater risk of being interpreted to be disruptive in some form or other. For example, they might be thought of as ignoring prison staff, where prison staff try to talk to them or something like that. And if they don't respond, it's thought that they're not responding because they're ignoring prison staff because of this lack of understanding. Equally, sometimes they're thought of as acting inappropriately. So in deaf culture, touch is quite an important part of the culture. But to tap a prison officer on the shoulder, that might be misinterpreted by a prison officer as aggression, as not something that's appropriate to do. even though it absolutely is appropriate within deaf culture. So this misunderstanding of deaf culture and the way that that works really has detrimental effects for culturally and linguistically deaf prisoners. I'm not going to read through the whole of this quote. I'll leave it here for a moment so you can read through it. But I think what this quote really gets to is that sense of being stuck without knowing what progress you're making, without being able to understand about how you're moving through prison, that sense of not being able to progress through, not really knowing what's happening and not knowing what to do about that, because prisons are so so kind of institutionally not geared up to support deaf people, that actually even that thing of knowing how to make that first step to deal with the issues that are going on is really difficult for prisoners in these circumstances. I'll leave that there for a moment more. So some of the impacts then of these kinds of issues for deaf people in prison, there are especially strong impacts in relation to mental health. The isolation that people experience, as you can imagine, kind of creates this real sense of loneliness. Very often people can't communicate with staff, prisoners, families, so this sense of loneliness of being alone. And even where that might be the case, there's often very little opportunity, as I spoke about earlier, to communicate in a person's own first language if their first language is BSL. Related to that isolation, a lot of people that we spoke to express feelings of depression, of to some degree hopelessness with the situation. And then also this sense of paranoia coming through. Within prisons, deafness, as you might be able to imagine, can be seen as a weakness due to being different in these kinds of environments. So there's this real sense of vulnerability to do with that, not being able to hear people talking about you, not being able to hear people entering your cell, to hear them if they're behind you, not being able to engage in the regime in ways that make it make one more able to cope within those environments. And then related to this, a strong sense of stress. We know that to some degree all prisoners experience quite a lot of stress within prison environments, but this seemed particularly related to this heightened sense of isolation, of paranoia, and of being unable to navigate the prison system and the prison regime. This sense of being unable to know what was going on and how to make this work, if you like. And then related to that, fear of not this sense of fear due to not knowing, due to reliance on others. One of the things that sometimes happens is that if you have to try and communicate with someone and you can't communicate with them, you're having to place your absolute trust in someone else to be able to navigate the prison regime for you, to be able to let you know, well, this is the way things work. And therefore that makes deaf prisoners incredibly vulnerable in that situation. So there's a question of, well, what if the trust is placed in the wrong person? The consequences of that can be incredibly severe. And this real sense of frustration, not knowing where to go or who to turn to for one's own needs to be met, and even how to get started with that. So this quote here at the bottom, I think, demonstrates some of this. Sometimes I cry just because I'm in prison. I cry a lot because there's nobody deaf. There's nobody deaf here. I can't communicate. I can't express myself to anybody. This real sense of isolation. And here I think it's probably also relevant to mention the case of Tyrone Givens. So Tyrone was a 32-year-old man on remand at HMP Pentonville from the 7th of February in 2018. He was a deaf hearing aid user with some mental health difficulties, and he spent almost a month without his hearing aid in prison and was not referred to the prison's equality officer, who had some expertise with supporting deaf prisoners. Tyrone very sadly committed suicide on the 26th of February in that same year, and the inquest into his death ruled that the failures of the prison to meet his needs contributed to his death. So you can see that actually the effects of this can be fatal in certain circumstances. So how do deaf people cope where coping might be possible within prisons? Well, to some degree, the issues that deaf people face in prison are somewhat familiar from outside of the prison. Generally, within the community, the needs of deaf people aren't particularly well met socially. So exclusion in schooling, using public services, things like that. So some people use existing or known methods of coping, either through withdrawal or expressing frustration. But these are problematic too. Withdrawal from the regime can lead to that sense of loneliness that we spoke about. Frustration can often be misunderstood for aggression. Sometimes people complain, but it can be really difficult to get complaints taken seriously. Recent research by the Prison and Probation Ombudsman has highlighted this real lack of trust in the complaints process for deaf prisoners. And although that's shared by many prisoners, that seems to be particularly acute for deaf prisoners. And one of the other things was that we saw quite a lot of referrals to secure psychiatric care, secure mental health hospitals. We've got some anecdotal evidence that suggests that there seems to be a lower bar for deaf prisoners to be accepted for psychiatric residential support compared to hearing prisoners. And that seems to be partly because this is seen as a less harmful alternative than prisons, where prisons are seen as inadequate in meeting these people's needs. But the downside of this is that deaf people can then become stuck in these psychiatric institutions because they need to demonstrate their reduced risk. Effectively, they're kind of there indeterminately. And even when that risk has been shown to be reduced, there needs to be suitable community placements for them to be released to. And that can take time as well. As kind of spoke about the issues with society, kind of social care outside of these institutions. So how do staff members respond to deaf prisoners in these situations? Well, prison staff commonly report being unable to understand how to appropriately respond to these prisoners and how to meet their needs. There's this real kind of lack of knowledge and resource and awareness here. So sometimes, for fear of not knowing what to do, that can mean that people don't do anything. And this quote kind of gets to some of that. This prison officer saying that when they came back from sick leave, the person, the deaf prisoner that they had been working with effectively had been left, and essentially they'd just been left during that time until the person came back from sick leave. And it kind of explains that situation in which people don't do anything because they fear doing the wrong thing. Sometimes as well, we saw attempts to communicate with deaf prisoners through inappropriate means, things like speaking louder, writing things down, or relying on other deaf prisoners to interpret. And that gives then a really problematic power relationship between the person that, or for that person that's interpreting, in terms of their role in relation to other prisoners and in relation to prison staff. And there can still be confusion about processes and responsibilities, even where that sense of deaf awareness is there. And as we spoke about earlier, this real misunderstanding of aspects of deaf culture. I do want to highlight, though, that prisons don't cater well for the needs of deaf staff members either. Both Laura and I have spoken to deaf staff members in prison, and their experiences generally seem to also suggest that prisons as institutions just aren't aware of their needs either, and that they can feel very vulnerable within those environments. So moving on then to talk about our current research that looks at life after prison. So this explores the lives of deaf people after their release from prison. And there's two stages to this. We did an initial scope and activity of services for deaf people with convictions. And most of the responses that we got in relation to this suggested that those deaf services did not provide specific support for deaf people with convictions, and actually in some cases explicitly refused access to services for deaf people with convictions. And we've also interviewed some service providers and some deaf ex-prisoners in relation to this. And I should say we're focusing here on culturally and linguistically deaf people in particular. Some of the things that we found are that access to services seems incredibly difficult for deaf people upon release. There seems to be this real difficulty in getting equivalent access to hearing former prisoners. Appointments are often not inclusive of a deaf person's needs. Things like booking a BSL interpreter for the wrong time or at the wrong location is a really common thing, and then that appointment effectively becomes useless. Ad hoc access, walking into a service, relies on that service being geared up to support BSL or being able to communicate in verbal or written English very often. And so ad hoc access to services is also really difficult. And where services do have the right support, quite often the awareness isn't there to recognise the specific needs of deaf former prisoners, that they're disproportionately likely to have experiences of trauma, both as children and as adults, and that can have effects for people. And courses, training and support schemes within the community are also often not available in BSL. So the kind of aspects of probationary work that might be expected are also not geared up well for deaf people. So there's this real sense of having to navigate systems yourself, because services quite simply don't cater for deaf people in quite the same way as hearing people. Also, as I spoke about earlier, support for mental health issues in the community is quite poor for deaf people. Thus, there's this kind of greater risk of institutionalization because community support isn't there. And we found that there really only seems to be one community-based support group set up for deaf people with convictions running throughout England and Wales. We did find another one that's in the process of being set up, but they were having some difficulties with setting that up. And then some of the other things we've found in terms of reintegration back into the deaf community after release from prison, there seems to be this real sense of isolation and exclusion from the deaf community after release from prison. Informal relationships, community groups, friends, there seems to be this sense of exclusion or isolation that sits across these different aspects of deaf community. And there are real questions for us about whether the stigma of the offender label is heightened for deaf people. A few reasons for this. I don't think we appreciated that when we've been speaking to people, they were saying gossip is really integral to deaf culture. So people like to know what's going on in other people's lives, and something like having a conviction is a really big piece of gossip for people. BSL is a visual language, so practically it's just very difficult to hide things, to have private conversations in an environment where lots of people are communicating through BSL. And people spoke a little bit about the smallness of the deaf world, that within a single town, lots of people know lots of people. So a sense of everyone knowing everyone. And without the deaf community, deaf people, as you can imagine, become quite isolated from social life and lose really vital connections that support their reintegration into the community. Some of the people we spoke to spoke about really difficult decisions upon release. So, for example, the decision between going back to your hometown, where you know the deaf scene, if you like, you know the services that are around, the ways of doing things, but everyone knows your business, everyone knows what's going on, everyone knows you. So that sense of gossip, of people talking behind your back, versus going to a new town or a new place upon release where, okay, not everyone knows your business necessarily, so might not be talking about you, but you don't know the deaf scene. So you then have to relearn all of those connections that you had to local services, to ways of doing things, to the kind of idiosyncrasies of a location. And some people also spoke about withdrawal from the community that they were part of before and attempts to reintegrate into other communities. We saw this kind of moving between kind of small d deaf and big D deaf cultures. So one person that we spoke to spoke about mixing much more with hearing people to try and avoid having to mix with the deaf people that he'd mixed with previously because of their views of him and of his conviction. And we also saw the same vice versa in a case. So I think what's really interesting for us here is that I think we'd thought that deaf identities would affect reintegration, but one of the surprising things that I think has come out of this as well is that reintegration can also seemingly affect deaf identities. There's an interrelationship rather than a one-way relationship. So just to summarise then, some of these things. Prisons are not designed for deaf people, and the roles and responsibilities of staff are often not clearly defined or understood. A lack of awareness, understanding, inclination and resources on the part of the prison service, as well as accountability, can all contribute to a lack of provision for deaf prisoners. Inadequate and inappropriate ways of working around that kind of lack of resources often then result, and these can be really problematic for deaf prisoners. And isolation, exclusion and poorer mental health are all consequences of these issues. And then in terms of thinking about post-release, there are often difficulties in accessing services, as we spoke about. Stigma and exclusion seems to be there for deaf communities, reinforced by this lack of specialist support groups for deaf people with convictions. People have to engage in these really difficult negotiations, for example, by changing location or changing relationships to deaf identity to try and deal with this. And that therefore deaf identities and reintegration are seemingly interacting on some level rather than it being a one-way relationship. So I'll stop talking now. There are Laura's and my contact details if anyone would like to get in touch or like to know more. We'd be very happy to hear from you. And thank you very much for taking the time to be here and for listening.
Fantastic. Thank you, Daniel. This is really, really informative. And also, thank you for shedding light on such a hidden topic. I will now stop recording and we